Good, happy Tuesday afternoon, May 12, 2020. I'm Riley King, and welcome to this Tuesday afternoon edition of the Riley King Newscast, right here on the Riley King Network. Let's begin. We have a lot of news to get to this Tuesday afternoon, so let's get started. First up, we're following breaking news right now. Live, Dr. Fauci, other top health officials testify on how U.S. can safely return to work and school. If you want to watch that, you can go to ABC News Live Facebook page, or we will share a link with you after this broadcast so you can see it if you want to watch it. And now let's take a look at your COVID-19 in New Hampshire information, what you need to know. And here is a look at that COVID-19 information. There are 3,160 number of people in New Hampshire who have tested positive for COVID-19. 1,385,813 number of people in the United States who have tested positive. 133 number of deaths from COVID-19 in New Hampshire. 318 number of people who have been hospitalized with COVID-19 in New Hampshire. And 81,791 number of deaths from COVID-19 in the United States. This map right here of New Hampshire shows you where current cases of COVID-19 are. In Manchester, 415. And this map here of New Hampshire shows you total cases of COVID-19. Manchester, 714. Now let's take a look at this chart here. Let's begin with new cases each day in New Hampshire. In the purple, new positive COVID-19 cases. In the orange, new hospitalizations. And in the red are the deaths. And then this chart here, current cases. In the purple, current COVID-19 cases. And in the orange, current hospitalizations. This chart here, total cases. Total COVID-19 cases are in the purple. In the orange, total hospitalizations. In the red, deaths. And in the blue, recovered. This chart here shows you by age group. This chart here shows you by female and male. And this chart here shows you risk information. This chart here shows you race/ethnicity of cases. And this chart here shows you percent of New Hampshire population. And your common symptoms: fever, lack of smell, cough, chills, and difficult breathing. How it spreads, and prevention tips. And be sure to stay with the Riley King Network for the latest of your COVID-19 information. Salem Selectmen adjourn without voting on proposed face covering order. Proposed 200 fine. Let's take a listen to that video from WMUR News 9.
These are truly challenging times, but New Hampshire companies are here and open for business.
During these times of uncertainty,
the proposed ordinance would require anyone in Salem over the age of 2 to wear some type of face covering while indoors in a public space. The proposal did not include outdoor spaces or restaurants, since restaurants are under more specific guidance from the governor's office. Jim Keller, the selectman who authored the proposal, says the main concern is to protect the townspeople from the influx of Massachusetts visitors, but not everyone was in agreement.
It's the business's job to protect their employees and to protect us.
The president didn't order this. The governor didn't order this. There can be a lot of disagreement there, but I don't agree with it. I think it's overreaching.
There was plenty of opposition from the public as well. Several callers pointed to enforcement, and the proposed $200 fine was simply too severe, especially with unemployment being so high.
I don't think that the punishment fits the crime.
People are struggling, so $200 fine is really, really, really crazy.
The governor was asked about the Salem proposal during his Monday press briefing. He essentially said the state would not get involved.
Look, if a town or city wants to take up those mandates for masks, there are towns and cities that have the ability to do that. That's their choice, and we're leaving it there.
So it was pretty clear that the proposal would not have passed if they had voted. No word tonight if that proposal or some version of it will be revisited in the future. Live in Manchester tonight, Jason King, WMUR News 9.
Okay, and there you go on that video and that report. Governor Baker of Massachusetts announces 4-phase approach to reopening Massachusetts economy. Let's take a listen to that video from WCVB Boston.
Brigham Health is working around the clock to defeat COVID-19. You can help our efforts by giving to our response fund, donating supplies, or hosting a fundraiser. We're stronger together. Learn more at bwhgiving.org/help.
This phase reopening could start as early as next Monday, but at this point, it's still unclear which businesses will reopen and when.
The goal is to begin this process around May 18th, but it will be gradual, and the facts on the ground will obviously determine whether we actually hit that goal.
Massachusetts now has a 4-phase plan to reopen, starting with businesses that have little face-to-face interaction, but which industries remain unclear.
I don't think any of us know what the businesses are yet. I think that the governor's approach to phase reopening, in my opinion, is the right way to do it.
The state says every company can start now to plan for new mandatory workplace safety standards. They include social distancing, requiring workers wear masks, and hand washing and frequent sanitizing.
These are the basics that every industry can plan for.
How and when the state steps up to another phase depends largely on the data. If cases increase again, we may be forced to roll back to an earlier phase. With reopening just a week away, city leaders ramp up their plans to enforce the new rules.
We want to make sure they have the proper protocol in place, the proper PPE that they need. Depending on what the industry is, are they doing cleaning? We would want to inspect that in the city because our inspectional services would be responsible for making sure that all the safety protocols in place.
And the Reopening Advisory Board will issue a full report next Monday, again, May 18th. Industry-specific guidance should also come in the next few days. Live in Boston, Sean Shai about WCVB News Center 5.
Okay, and there you go on that video and that report. Maine National Guard flyover honor healthcare and essential workers. The Maine National Guard honored the state's coronavirus health care workers and other essential personnel with a flyover on Tuesday. The flyover will take place Tuesday over several Maine communities. The flyover was conducted by a KC-135 aircraft from the 101st Air Refueling Wing in Bangor and took part over several Maine communities. This event was part of the Operations American Resolve, a nationwide salute to those supporting COVID-19 response efforts. The entire Maine National Guard is honored to extend our heartfelt gratitude to all the healthcare workers and first responders who are working on the front lines to combat COVID-19. We are so deeply grateful for those essential personnel diligently working to keep our shelves stocked and families supplied, said Major General Douglas Franham, Maine's Adjutant General. The Guard said the flyover provided training hours for the air crews and will be conducted at no additional cost to taxpayers. People who live along the flight path were encouraged to maintain social distance guidelines during this event. The flyover began in Farmington at 10:30 before going over Lewiston, the Portland area, Augusta, and Mid-Coast area, Bangor, and down East Maine. Because of poor weather conditions in northern Maine, that portion of the flyover was postponed. That allowed for additional flyovers in the Mid-Coast and down East Maine. We want local workers and residents to be able to enjoy the event in better weather conditions with better visibility, Franham said. We will provide an update, date, times, and approximate flight path as soon as the planning is complete. UVM Medical Center takes precaution to keep new moms' babies safe during hospital stay. Staff are screened for COVID-19 every time they go to work. Let's take a listen to that video from NBC 5 News.
Palmer Low Real Estate thanks all those serving on the front lines.
I felt like it was a roller coaster of feelings.
New mom Meg Grass didn't know what to expect as she was anticipating the birth of her firstborn at the University of Vermont Medical Center during the pandemic.
When would be a good time? What if I have to be induced? Should I do it now, early on, when the hospital looks good, before there's a huge rush? It's very safe to still have your baby at the hospital.
Nurse and midwife Marty Churchill says the hospital continues to take multiple steps to make sure moms and babies are safe during their stay. They're only allowing one support person to be there for an expectant mother to help prevent the spread of the virus. Staff are also being screened for COVID-19 every time they come into work, and coronavirus testing is available for expectant moms if they want it.
The idea is to provide her with information about her own health if she were an asymptomatic carrier, and also for the staff so that we can all be as safe as possible.
Churchill says so far no moms, babies, or staff members have tested positive for COVID-19 as they continue to support new parents during these life-changing moments.
It's really a wonderful time to be a part of people's family.
I can't say enough about the staff. They were incredible.
Grass is grateful for the support of hospital staff and her husband, Peter, who were all by her side to welcome their new son, Camden, into the world 2 weeks ago, a gift she's not taking for granted.
There's good in the world, and just thinking about our little baby, and it's been really exciting.
Liz Streppa, NBC 5 News.
Okay, and there you go on that video and that report. Cute little baby there. Rhode Island reports 14 more virus-related deaths, 164 new positive cases. Rhode Island Department of Health on Tuesday reported 14 more deaths related to the coronavirus and 164 new positive cases. It was the fewest new positive cases in a day since April 6th. The state has recorded 444 deaths from COVID-19 and 11,614 total positive cases. Rhode Island DOT said 277 COVID-19 patients were in the hospital, with 72 in ICU and 53 on ventilators. Rhode Island governor has scheduled her daily briefing for 1 p.m. today. Children with mystery inflammation illness being treated in Connecticut. Let's take a listen to that video from Eyewitness News 3.
Continue our team coverage of the coronavirus outbreak now. 3 pediatric patients at Yale New Haven's Children's Hospital are being treated for a rare inflammatory condition, the one you've heard about. It's possibly linked to COVID-19. Cases have been reported in Europe and the U.S., and now our state is on high alert for more Connecticut cases. Channel 3 Eyewitness News reporter Eva Zamaris joins us with what parents need to know. Pretty scary stuff, Eva.
Pretty scary stuff is right. Good morning to you, Eric. A lot is still unknown about the coronavirus and now this inflammatory condition. But doctors say that there is one thing that's been made clear. This illness is very rare. Now, in the cases reported so far, children have been as young as infants and as old as young adults. Now, dozens of children in the U.S. have been hospitalized with a serious inflammatory condition possibly linked to the coronavirus. Now, 3 cases have been reported at Yale New Haven Children's Hospital. Here's what we know right now. Dr. Thomas Murray, who works at the hospital, tells Eyewitness News it seems to affect children who have already had the coronavirus. He explained to us a child's immune response is typically strong. So when they do get COVID-19, the immune system goes into overdrive, fights off the virus, and gets rid of it. But once the virus is gone, the overdrive doesn't go back to normal. It's still turned on, and then it can infect organs.
Clearly, there's something very different about the way kids interact with this virus and adults, and it's just a mystery right now.
Now, it is important to note that the symptoms do vary from child to child, but you should call a doctor immediately. If your child has a high prolonged fever, severe abdominal pain, trouble breathing, redness around the eyes, and a rash, we do have much more on all of these symptoms right on our Channel 3 app. Eva Zamaris, Channel 3, Eyewitness News. Eyewitness News this morning continues right after the break.
Okay, and there you go on that video and that report. Dow rises slightly. NASDAQ struggles after 6-day winning streak. Stocks struggled in early trading Tuesday as investors evaluated the latest attempts to reopening the economy. Overcrowded concerns on planes. Let's take a listen to that video from ABC News.
Airports here in the U.S. are seeing the highest number of passengers since March, and now overcrowding is a concern. ABC's Inez de la Cuetara reports.
This morning, new fallout for the airlines.
Please maintain a distance of at least 6 feet.
Not one, but 2 carriers under fire after passengers posted these pictures, sparking outrage over the lack of social distancing.
I'm probably more likely to get infected there than I would be in the ICU.
This photo was taken by a doctor flying home after spending weeks working on the hospital front lines in New York. United Airlines flew him, along with 24 other volunteers, for free, promising to keep the majority of middle seats empty.
I'm more scared about getting on the airplane than I am about walking into the hospital.
But when the team boarded their flight, only 22 of the nearly 200 seats were vacant. The doctor tweeting, "I guess United is relaxing their social distancing policy these days." His post going viral, with other airline passengers sending out their own full flight photos.
Are we talking about revenue for the airlines, or are we talking about safety for the people? Because they're on 2 completely separate wavelengths.
Among those complaints, this picture of a busy American Airlines flight. The passenger saying it felt like a sardine can, showing at least 6 rows filled. But American says it held to its promise, even going above and beyond by keeping nearly 3/4 of the middle seats empty.
We were sitting 3 in a row, like total 6 in a row, and it was full packed.
Despite the airline's best efforts, many flight attendants say they're worried.
This really has to be something that is coordinated by the federal government. Passengers have to wear masks now, but social distancing policies are inconsistent, and you just can't count on the fact that you're not going to have someone sitting right next to you on a flight.
United Airlines responded to the doctor's post, saying while his flight was nearly full, most flights are less than 50% full, and that United is limiting advanced seat selection. But the airline acknowledged it cannot guarantee everyone will be seated next to an empty seat. Kenneth and Mona.
Inez, thank you.
Hi, everyone.
Okay, there you go on that video and that report. Thank you for joining us for this afternoon edition of the Riley King Newscast right here on the Riley King Network. Have a great rest of your afternoon. I'll see you back here later on today for another newscast. And I'll have a news report coming up in a little bit. Goodbye, everyone.